Ozempic is the brand name for semaglutide, which is to be taken once every week as an injection subcutaneously to treat diabetes, and occasionally it's also used for obesity management. It comes in different pen devices, and there has been some confusion about the number of dosages that one can receive from one pen device. Normally, if you have a 1 milligram pen, you can only get a 1 milligram dose from this pen device if you dial all the way to the end. And taking the 1 milligram dose from this pen device would finish this pen device after 4 dosages. This is the standard. Now, just to clarify the confusion, the 1 milligram pen device has got 3 ml of Ozempic, which is irrelevant for the patients because sometimes they do ask this question. It can give you 1 milligram dose if you dial all the way to the end, because sometimes patients might be doing less number of clicks, so that creates a confusion how many dosages it will give. This would give them 4 dosages if it is used properly as a 1 milligram pen device. Now, as you can see, we have the 1 milligram pen device which has 3 ml of fluid, and once the fluid is completely finished, this piston will be visible till the end, and if any fluid is left, then you will see that the piston has not gone all the way to the end. There are 2 other types of pen devices. This is a 0.5 milligram pen device, and if someone is using this, now this device is completely used, so the dial doesn't go all the way to the back, and you can see that the piston has come all the way to the end. Similarly, this is a 0.25 milligram pen device of Ozempic, and as you can see, this is completely used, therefore the dial at the back is not going to move. Now, one thing is interesting, because all the Ozempic pen devices are supposed to give you 4 dosages. However, the 0.25 milligram pen device has got more volume for the amount of dose. One thing is not specifically advertised on the boxes of Ozempic, that the 0.25 milligram pen device has the same volume as the 0.5 milligram, which means that if this pen device can give you 0.5 milligram 4 dosages, so does this device. But actually this one is designed to give you 0.25 milligrams, which means that after 4 dosages you will still have half of the medication left. Now, in order to make sure that you do not discard the medication and use it properly, I would show a demonstration on a demonstration pen, which is designed to show you how a 0.25 milligram device would work. Now, this is a demonstration pen. Now, this is an unused demonstration pen, which shows that the fluid is all clear and the piston is not visible. The dial easily goes all the way to the back to give you 0.25 milligrams. Now, let's have a look at how 4 dosages would finish this pen device. I'm going to attach a needle. Now, I'm going to show you how a pen device should completely finish when you have utilized the proper number of dosages from that pen device. This is how we would be attaching the needle. We remove the cover from the back of the needle and screw the needle on the top of the pen device, just like a screw, to make sure it is tightly fitted. And then we remove the outer cap and carefully remove the inner sheath so the needle is exposed, and we dial the back to see it goes all the way to 0.25 milligrams, and when we press the back button, you will see the 0.25 milligram going all the way back to 0, and the first dose has been administered. Now what we are going to do is do the next dose. Now let's see if we dial at the back, and if you do a press, you can see the fluid coming from the needle, and this is your medication. And as you are injecting every time, you will see the piston in the middle gradually coming down. Now let's do another dose from the same pen device, and as we do another dose, you can see the piston is going down. So every time you will do your dose, you will see this piston moving, and this will give you an idea that your dose is going in properly and you have got a certain amount of medication left. And as I've done the fourth dose here, you can see the piston is still halfway, which means that we have got half of the Ozempic pen consumed, but half of it is still unconsumed. This type of issue is only seen with the 0.25 milligram Ozempic pen devices and is not seen with the other pen devices, which means that if you are taking 1 milligram from the 1 milligram pen device, this should be consumed in 1 month. If you're taking 0.5 milligrams from the 0.5 milligram pen device, it should also be consumed in 1 month after 4 dosages. But if you're using 0.25 milligrams from the 0.25 milligram pen device, then you will have 8 dosages, which means that the pen device should be used for 2 months. It is more advisable that the patients should consume the full dose present in the 0.25 milligram pen device. It clarifies that the 0.25 milligram Ozempic pen device has got 8 dosages, although the needles provided in the box are only 4 with 4 dosages. However, you can buy the 4 millimeter sized insulin pen needles, which fix absolutely perfectly on top of your Ozempic pen device and would allow you to keep using it until you have fully consumed your medication. Thank you. Make sure whenever you inject, you're using a new needle to ensure that there's no cross-contamination of your pen device and you do not infect your injection sites. Utilization of the full medication from the pen devices also ensures that there's no wastage of the medication at times when there is already significant shortage in the market. Thank you.